As pet parents, we love everything about our furry friends, from their wet noses to their wagging tails. But one area that often needs our close attention is their ears. Ear infections are quite common in our animal companions, especially in dogs with floppy ears. Most of the time, these are simple outer ear infections, or otitis externa. However, sometimes the problem can go much deeper, affecting the delicate structures hidden from view. It's so important to understand these deeper ear issues, as they can cause a lot of pain and lead to more serious problems if we don't act quickly. Keeping their ears healthy is a big part of keeping them happy. To understand what's happening, let's take a little tour inside your pet's ear. The part you can see and clean is the outer ear canal. It leads down to the eardrum, a thin membrane that separates the outer ear from the middle ear. Behind this eardrum is the middle ear, or bulla, a small, air-filled, bony chamber. This is where otitis media happens. Even deeper inside is the inner ear, which contains the delicate nerves for hearing and balance. When an infection reaches this part, it's called otitis interna. These two conditions are often linked, as an infection usually travels from the outer ear through the middle ear and into the inner ear. An infection in the middle or inner ear is much more serious than a simple outer ear infection. The middle ear contains tiny bones and connects to the back of the throat through a small tube. The inner ear is the control center for balance and hearing. An infection here can disrupt your pet's whole world. It can make them feel dizzy, unsteady, and very unwell. Because these parts are so hidden and so sensitive, problems here need a vet's attention right away. Think of it like a house. A problem in the hallway is one thing, but a problem in the foundation is something else entirely. The most common way for otitis media to start is when an outer ear infection is not treated properly or keeps coming back. The infection can eat away at the eardrum and then spread into the middle ear space. In some cases, bacteria can also travel up from the throat and into the middle ear. Once the infection is in the middle ear, it can easily spread to the inner ear, causing even more trouble. This is why we vets always stress how important it is to treat any ear issue, no matter how small it seems, as soon as you notice it. Early action is truly the best defense. When an ear infection is only in the outer canal, you might see your pet shaking their head, scratching their ear, or notice a bad smell. But when the infection moves deeper into the middle or inner ear, the signs can become more worrying. For otitis media, you might still see some of those common signs, but they could be more severe. Your pet might cry out in pain if you touch their head or ear. They might hold their head tilted to one side, which is a classic sign that the problem is deeper than the surface. They could also have trouble chewing their food or seem reluctant to open their mouth wide. If the infection progresses to the inner ear, causing otitis interna, the symptoms become even more dramatic. This is because the inner ear controls your pet's balance. The head tilt might become very extreme. Your pet might seem very dizzy and uncoordinated, walking in circles or stumbling and falling over as if they are drunk. You might also notice their eyes darting back and forth very quickly, a condition called nystagmus. Some pets become so nauseous from the dizziness that they vomit or lose their appetite completely. These signs are a clear signal that your pet needs urgent veterinary help. It's also important to look for changes in your pet's face. The middle ear is very close to some important facial nerves. If the infection causes inflammation there, it can affect these nerves. You might notice that one side of your pet's face seems to be drooping. For example, their lip on the affected side might hang lower, or they might not be able to blink their eye on that side. This is a condition called facial paralysis. Seeing this can be very alarming for a pet owner, but it gives us vets a very strong clue that the problem is located in the middle ear. Remember, your pet can't tell you what's wrong, so we have to be their detectives. Any sign of ear trouble, like scratching or a head shake, is a reason to take a closer look. But if you see any of these more serious signs, a head tilt, loss of balance, walking in circles, or facial drooping, it's an emergency. These are not signs that will get better on their own. They point to a significant problem in the delicate middle or inner ear, and the sooner we can start treatment, the better the chance your beloved companion has of making a full recovery. When you bring your pet to the clinic with these worrying signs, our first job is to do a very thorough examination. We start by talking to you about the history of the problem and all the signs you have seen at home. Then, we perform a full physical and neurological exam to check your pet's balance, reflexes, and nerve function. This helps us confirm if the signs are truly coming from the ear. A key part of this exam is looking deep into the ear canal with a special tool called an otoscope. We want to see if the eardrum is still intact or if it has been damaged by the infection. Often, examining the ear of a pet with a middle or inner ear infection can be very painful for them. To get a really good look without causing distress, we usually need to sedate or anesthetize your pet. This allows us to be very gentle and thorough. While they are safely asleep, we can flush out any debris from the ear canal and get a clear view of the eardrum. Sometimes we can see that the eardrum is ruptured or bulging from the pressure of fluid trapped behind it. We might also take a sample of any discharge to send to a lab to find out exactly which bacteria are causing the trouble. However, just looking with an otoscope doesn't always give us the full picture. The middle and inner ear are hidden inside the bones of the skull, so we can't see them directly. To see what's happening in these hidden areas, we need to use advanced imaging. X-rays of the skull can sometimes show us if there is fluid or abnormal bony changes in the middle ear bulla, but the best way to see everything clearly is with a CT scan or an MRI. These powerful imaging tools give us a detailed, three-dimensional view of all the delicate structures inside the ear. A CT scan is fantastic for looking at the bony structures of the middle ear, while an MRI is better for seeing the soft tissues, like the brain and the nerves of the inner ear. These scans are the gold standard for diagnosing otitis media and interna. They help us see the extent of the infection, check for any growths or polyps, and plan the best course of treatment for your pet. It might seem like a big step, but getting this clear diagnosis is crucial for giving your pet the targeted care they need to get back on their paws. Once we have a clear diagnosis, we can start treatment. The main goal is to clear the infection and reduce the inflammation. This almost always involves a long course of antibiotics, often for 6 to 8 weeks or even longer. It's so important to give the medication for the entire time prescribed by your vet, even if your pet seems to be feeling much better. Stopping too soon can allow the infection to come roaring back. We choose the antibiotic based on what we find from culture samples, making sure we are using the most effective weapon against the specific bacteria causing the problem. Alongside antibiotics, we often prescribe anti-inflammatory medications to help reduce the pain, swelling, and dizziness. Medications to help with nausea are also very helpful for pets who have lost their appetite or are vomiting due to the inner ear being affected. In many cases, we will also need to perform a procedure called a myringotomy while your pet is under anesthetic. This involves making a tiny, careful opening in the eardrum to flush out all the infected material trapped in the middle ear. This immediately relieves the pressure and allows topical medications to reach the source of the infection. Unfortunately, some cases can be very difficult to cure with medication alone. If the infection is chronic, has caused a lot of damage, or if there is a tumor or polyp involved, surgery may be the best option. The most common surgery is called a total ear canal ablation and bulla osteotomy, or TECA-BO. This procedure involves removing the entire ear canal and opening up the bony middle ear to clean out all the diseased tissue. It's a major surgery, but for pets with severe end-stage ear disease, it can provide a permanent cure and finally relieve them of their chronic pain. As a pet owner, your role in their recovery is so important. You will need to be patient, as recovery can be slow. It involves giving medications consistently and watching your pet closely for any changes. Monitor their appetite, their balance, and their overall comfort. Keep in close contact with your vet and attend all follow-up appointments. Remember, early detection and treatment give us the best chance of success. If you ever notice your pet tilting their head or seeming off balance, don't wait. Getting them checked out right away is the most loving thing you can do.